Oh, wait, did I do that right? Hang on. Oh, I have to stop share for a minute because I want to recording. Oh, I am recording. Okay, great. Thank you for the reminder. Okay, so a couple of things with questions, okay? Do not be afraid to select all with select all that apply. Okay? I think on the first exam, we had 3 questions for select all that apply that everything applied. So do not be afraid to select all that apply. Okay, these are my tips that I like to give. For any of you that change your answer, my advice to you is you better make sure that you have a valid reason you're changing your answer. Okay? Like, and it's not, I think, or if there's any uncertainty, do not change your answer, or meaning if it's not a concrete example. Okay, does that make sense? If it's, well, I think I read that somewhere and I think it said, no, do not change your answers. Okay, bad habit. Another tip is once you read a question, try and cover up the answer. So try and look away and think of what would be the right answer. What color is the sky? Okay, you look away and think, well, the sky's blue. Are one of those answers blue? Then that's probably the right answer. Does that make sense? So try and come up with a answer in your head first before you look at the answers. Does that make sense? Another thing, a couple of questions. Read if you have a difficult question, right? Read it through twice. Okay. If it's still completely foreign to you, guess and move on. It's one question, guess and move on, because it's going to increase your anxiety. It's going to decrease your confidence. So read it twice and move on. Okay. So those are some of my, please read the question carefully. You have a piece of paper next to you, write down a priority word. I did a review with a student this morning that every single question she missed had a priority word in it. Priority, most, least, best, first, last. Okay? You got to be able to pick out those words because those are going to lead you to the answer. If you miss that key word in the question because you're going too fast or whatever, you got to be able to pick out that word. Make sense? And then also be mindful of the questions that are asked. I call it the negative way. So in speaking in training a new nurse, working with a hospice patient, what would the new nurse say to the hospice patient that indicates she needs more teaching? So what kind of answer are we looking for? Something that she says that's wrong, right? Okay. So, or, in talking with a parent, which statement by the parent indicates that they need more education? Let's see, cigarettes. Which answer that the parent says indicates they need more teaching about cigarettes, whatever. And what I think the right answer is, oh, don't worry, I smoke e-cigarettes now. Is that what, you don't want to hear them say? Right. So be careful of those questions where it asks it in the negative way. And I haven't found the right way to describe that yet. It's not really in a negative way, but it asks it in a different way, kind of going the roundabout. Does that make sense? So those are some of my tips. Multiple choice, select all that apply, math problems. Math problems are pretty easy formulas. I've given you guys all the math resources to be able to figure out simple formulas and simple calculations and simple conversions. So, you know, you need to go back to those if you're having problems with math. Okay. General questions to review, IB calculations. Here's some tips for math: determining equivalence, oral and parenteral medication, medication doses for kids, right? Review math handouts and practice questions. I've given you guys, well, not you, you guys, no, this isn't my class, but your professor should have provided you math resources. We all give out math resources at the beginning of the term. Okay, case studies of concepts. You guys have student resources, right? That have NCLEX questions, case studies, right? You have all that? You should, right? So hopefully you're reviewing your case studies. Remember your prioritization questions. We talked about that. Remember the ADPI. You have to be able to take your ADPI and apply it to community. Okay, so your assessment of a patient in the hospital might look different than your assessment of a family in the community. Right? Remember safety first, right? ABCs. What's a priority? Prevention levels. You know, what's primary, secondary, tertiary related to each chapter. Okay, and the nursing process, which is the ADPI. Okay. You should have a look at your Healthy People 2030 objectives in each chapter that we're covering. All right, so the chapters up here, all those, take a peek at those 2030 objectives in each box in each chapter. Okay. Obviously, it's not an all-inclusive study guide, but we do our best to put this together based on lectures, based on the PowerPoints we send you, and based on lectures and the readings. So that's where your study guides come from. Okay, so nothing on your study guide. If you've been to class the last 3 weeks and you've paid attention and listened, none of what we're going to go over should be unfamiliar to you. What I tell my group is, start looking at your study guide early. After each week, go through and check off what we went through, right? And so by the end of the week before the exam, excuse me, all of this information should be highlighted or checked off that you went through it. Does that make sense? You guys following me?
Yes.
Everybody's quiet.
Uh-huh.
Are
Yes,
you guys
we're
all
following,
following me?
Professor.
Okay.
Mm-hmm.
So let's go through the study guide. So the first, community assessment and evaluation. Okay, that was a whole section we covered. Okay, so a few things that you need to know, and I'm just going to try and highlight the important parts of each paragraph. Okay, this paragraph has to do with, what are the dimensions of the community? How do we look at the community? We look at it by place, people, and function. And what does each of those mean? It tells you right here in this paragraph. When measuring dimension, you look at data sources from the census data. So it's, how do you gather the information? Okay, the dimension of place would be maps, newspapers. Okay. So we need to know that. When completing a community assessment, the nurse will include a community systems category found within there's 5 community, each community is assessed by 5 different factors. Okay, they're called system categories. Okay, and they are these 5 things. So what kind of question could you potentially get about that? Give me a question.
SATA.
Yeah, well, tell me what it is, though. What's the question?
Let's see. How would you measure data sources? I'm sorry, I'm looking at the wrong thing.
No.
How would you categorize community systems?
Yep. Or what are some of the categories found in every community during your assessment? Every community has politics, education, recreation, economics, religion. May not look the same in every community. In fact, it doesn't. But those are the 5 common categories. Okay, you need to know about active and passive partnerships. Okay, do you guys know what an active and passive partnership? What is it?
Active is like when you're active with the patient, and then passive, I think you're just observing or watching.
Think about the community though. So active means you're actively participating in the present. So the example we use for active is, let's say there's a business in the community that pays for school lunches or after school snacks for kids. They are directly impacting in a partnership. Okay, where passive would be all the people that are on the outside. For example, maybe city council or people that are planning things, planning to build a new park, planning to do this, but they're not, it doesn't have a direct impact just yet. So they're kind of behind the scenes. And that's what this paragraph explains. Okay. Okay, you need to know the difference. I hope everybody's read through this, and this isn't the first time we're covering it. You need to know what the difference between data gathering is and data generation. Okay, think about it. If you have to generate data, that means it doesn't exist. You have to generate it, right? So that's a difference. Data that does not exist. That's generation. Oh, excuse me. Sorry. Data generation. Okay, and it gives you some examples. What's data gathering? You're gathering information that already exists. But again, just because I'm just highlighting keywords, you are responsible for the whole paragraph. Okay, I'm just trying to organize it for you so it doesn't seem so overwhelming. What I'm trying to do is pull out keywords like you need to do in questions. Make sense?
Yeah.
Okay, here's a windshield survey. If you don't know what a windshield survey is, you need to know. You're going to get asked about that in the exam. Okay, what's a windshield survey? Think about it. It's exactly what it says it is. What is it?
When you drive in your, oh, go ahead, driving in your car, observing.
Observing. Doesn't matter if you're looking out the windshield of your car, or a train, a bus, walking around on your bicycle. Right? You got to understand the boundaries of the community so you're not, riding into the next town. Right? And what kinds of things would you be looking at? Maybe population size. What is it? A clean community? Is it a dirty community? Does it have high crime? Does it have people walking their dogs? Does it look nice? Does it look beat up? Are people out in public, or is it people aren't out in public? Let's say you're the community nurse going into a new community, you're starting a new job, and you've been asked to do a community assessment. Hey, we have concerns about our community. We need you. You're the new community nurse. What do you think? You go out and do a survey. Those are the kinds of things you should be looking at, right? Because you then have to create your needs assessment. What does this community need? Okay. Know your transitional care settings. Okay. So your transitional care means where are people going? Are they going from their home to the hospital? Are they going from the hospital to rehab? Are they going from rehab home? Are they going from long-term care to assisted living? That's all what transitional care is. Okay. So transitional care is exactly what it says it is, transitional care. Okay, so there's different kinds of transitional care, so you have to look that up. But think about it. Well, where do patients transition? Hospital to home, hospital to long-term, hospital to assisted living, hospital to rehab, and vice versa. Okay, so there's Lots of information on community needs assessment and evaluation. Evidence-based practice, do you remember that? What's evidence-based practice?
Practice that has been proven to work and put into place by nurses.
And why is it important?
That's how we improve and we build up on quality assurance, and it diminishes and decreases errors.
Yeah, that's
and things
exactly
that we
right.
need to-
Our nursing profession is founded on evidence-based practice, right? We're always continuously striving to improve, right? And we improve based on evidence, whether it's research, clinical research. I mean, evidence-based practice represents a cultural change in practice. Does anybody work with people that say, nah, we've been doing it like that for 30 years, it works fine? Anybody work with people like that?
Oh, yeah.
Yeah, well, those people, those types of coworkers, really evidence-based practice, yeah, it's all good stuff, but as far as changing practices, it's hard. It's hard.
It is.
It's very hard. So it represents a cultural change, right? And like you said, it provides improved both nursing practice, and when you can improve your nursing practice, you improve patient outcomes. Right? And so one of the first steps in looking at evidence-based practice is checking your own beliefs, right? Do you believe that you are providing the best care based on the evidence you have? That answer may be yes. But then further, are you willing to change your practice based on new techniques, new medication, new technology? Okay, it's hard. It's hard to make those shifts, but that's what evidence-based practice is all about. And that's within our scope of nursing, that we do the best we can with the knowledge we have, and we try and get the best practice models, the best evidence, the best outcomes. Okay. Next section is disaster. There's several questions on the exam about disaster management. Let's talk about some of the information that you'll need to prepare, you'll have to have prepared to answer the questions about disasters. Okay, well, there's two types of disasters. What are they?
Man-made and natural.
What's an example of a natural disaster?
Tornado,
Hurricanes.
hurricane.
What'd you say, Elba?
Hurricanes, tornadoes,
Yeah.
pollution.
Earthquakes,
Well, wait.
droughts.
Who said pollution?
Oh, I did, but that's man-made. Sorry.
That's man-made. That's man-made. What are some other examples? Go ahead.
A better example of what,
Anthrax
Professor?
was I think anthrax is a man-made, right?
Right.
I
Correct.
Or
remember that
bombs.
example.
Man-made's pollution, warfare,
Bombs.
Fires.
water contamination. Okay, I suggest you go back to the disaster chapter and have a look at, this should say Healthy People 2030. Look back at the 2030 objectives for a disaster. Okay, what are their objectives? Okay, well, their objectives are related around disease mitigation. This is what they're about. Disease mitigation, focusing on preparing, alerting, and caring for a disaster within a population. That's what the heading is. But here's some objectives. One objective focuses on increasing the proportion of crisis and emergency risk, so communication to the public. That's one goal. Home safe. So there's 3 goals mentioned here. Please know these. Okay, so go back and read this box. I don't know what page it's on, but it's in your disaster management chapter. Okay, let's say you have to teach a family how to prepare a disaster kit. Do you guys know that? There's a nice little box in the disaster chapter about what belongs in a how to prepare a family, how to teach a family how to put together a kit. Okay, there's several things in this paragraph that you need to know. This could be a select all that apply question. When teaching a family how to prepare for disaster, what do you do? Okay, or let's do it the other way. What do you not do? Okay, you got to be prepared for that to be asked both ways. And that's really important. So there's several things. Stock enough food for 3 days, review the kit every 6 months. Not 3 months, 6 months. Remember, food for 3 days, review every 6 months. Right? Don't reverse that. We don't need food for 6 months. Okay? We need food for 3 days, review the kit every 6 months. Does all the family know? Do they know where the kit is located? Do they all know how to turn off utilities in case they need to for the house? Okay. So this is all, I'm just reading from here. This is all in here. Reviewing the supplies every 6 months. Okay. Make sure there's nothing expired. Okay. What's the purpose of a mass casualty exercise? What's the purpose? Right here. To evaluate the agency's response and validate the capabilities. This is, if you're working in the community, you got to know this stuff. Okay. What if the question says, okay, we're working on a mass casualty exercise. What is the priority outcome of this? I'm just making up a question because I see this, it says the priority outcome, right, is to see what the amount of time is for emergency response to be activated. So what if you got a question during a mass casualty exercise, what is the priority outcome? What's the answer?
Evaluate the amount of time it would take.
Exactly.
The emergency.
Exactly. So as you're reading through each of these paragraphs, think what kind of question could be asked? Could that be like up here, maybe this disaster kit, there's so much information that maybe that's a select all that apply. Or maybe it's asked what should not be in the disaster kit, right? And then how about a question about this? When federal emergency has been declared, the NRF, National Response Framework, may provide specific needs to the community. The role is to support the community experiencing a disaster with transportation, temporary housing, medical resources, search and rescue, and firefighting. What if the question is, what agency is responsible for stepping in and assisting the community? The CDC, the WHO, the NRF, the NIH. Does that make sense? So you got to know what that is. Okay.
Yeah.
Or a different question could be, the NRF is the one who steps in when there's an emergency. What kinds of things would they help with? Select all that apply.
Right.
Transportation, housing, medical resources, search and rescue,
Search and
firefighting.
rescue, firefighting.
I'm just throwing this out there. Just try to talk you through. That's what I want you to, okay, I just read through that paragraph. What do you think they might ask me? Well, that National Response Framework does a lot of things. Maybe they're going to ask me what they do.
Select all that apply. Mhm.
Yeah. Maybe, I don't know. Or what do they not do? You know, let's say the answers are transportation, temporary housing, medical resources, mental health care, and firefighting. What's the right answer of what they don't do?
Mental health care.
mental health
Right.
Mental
care.
health care.
Yeah, that's not in here. Right?
Right.
Using health information. Okay, so this is about education. When developing a community-based education program, right? What's the first thing you have to determine before you develop an education program?
You need to know who it's for. What
Right.
kind of, who are you
Population.
doing it for?
Right. Because if you can't identify your population, you can't really identify the issue, right? So the nurse identifies the issue that requires the education, right? First, you need the population, right? Then you need the issue. right? That requires education. Then you need to select the learning theory as a framework. And then you choose teaching strategies to implement. So that paragraph has a lot of information. There's 4 parts to it. When you're developing when you are developing a community based education program, there's 4 phases right here. First, determine the population. Second, what's the issue? Third, what's the learning theory? And fourth, what's the teaching strategies? Right? And then you guys remember from class, we talked about how do we learn? We all learn different, we all learn these 3 ways, but we prioritize one over the other, right? But we learn cognitively. What's cognitive?
By thinking.
Thinking. What's
Mhm.
affective? Feeling. And what's psychomotor?
Doing.
Doing. So we have to think of all those 3 types of learning when we're developing education programs. Maybe a third of your class learns best cognitively. The other third learns best affectively. The other third, for me, I'm a psychomotor, I'm hands-on. If I ask my kids a question about how to fix my phone and they start talking to me, I can't even, just show me with my phone. Don't tell me over the phone because I can't figure it out. Okay. And then the teach back method, right? What's the teach back method?
Having
When
return
they
demonstration.
show you what you, yeah.
Go ahead, say it again.
Return and demonstration of what you
Mhm.
taught them.
Yep. That's how people learn, right? They demonstrate what they were taught. Okay. Okay. Here's some different types of learners. Okay. Adult learners, Generation X learners, the Net Generation learners, and then the baby boomers. So you'll get asked a scenario about something about education. And it's going to say something like, I'm working with a group of people that they learn based on their generational characteristics. What type of learner is this? Is this a Gen X learner? No, I'm sorry. The question is, I'm teaching a bunch of people and they are self-directed and like to work in teams. Is this a Generation X learner, a Net Generation, or a baby boomer?
Gen X.
Right. I'm teaching a group of learners that they just would prefer to have the instructor lead everything. Well, who am I teaching?
Baby boom.
Yeah. Okay, so know those. This next part is government and law. There's three things that need to be in place, 3 conditions that have to be met before malpractice can be proven. Okay. And there's your 3 things. Yeah, you or me, I'll speak for me. I had the duty to provide reasonable care. I breached either through an act of omission or failure to act. And then that act of omission caused injury or damage. Okay, so those need to be, all 3 need to be met. So maybe you get asked, how many conditions are there? Or pick the condition that needs to be present, one of the 3 conditions that needs to be present. But that's what I want you to know, is you need to know there are 3 conditions, specific conditions that need to be met. Okay, next is the World Health Organization. What do you need to know about that? You need to know that it's the one international community that deals with community and public health. Okay, so if you get a question about what does the World Health Organization represent, or what do they do? And it says, anything with the word what? International in it, right? Country to country, right? They're international. And then here's all our federal agencies. Okay, and so have a look at this. This is all definitions. What's the Agency for Healthcare Research and Quality? What's the CDC? Okay, what's the Health Services Resources and Service Administration? Okay, what's the NIH? So you have to just break down these questions, break down these paragraphs. So 1, 2, 3, there's 4 definitions in that paragraph. So you're going to be presented a scenario to say, okay, which of these agencies would deal with what? So it tells you what they do. So if it says, which agency is responsible for monitoring health, detecting problems, and implementing prevention strategies? Your answers are Agency for Healthcare Research and Quality, the WHO, the CDC, the NIH. What's your answer?
WHO.
No, Centers for Disease. I just read it right from here.
I'm
Remember, WHO is international. My answer didn't
Okay.
have international in it.
Okay.
Make sense?
It does.
Yeah.
I'm on
So,
a different
so
paragraph.
don't be overwhelmed by all these words and stuff. Just break down each little section separately. Okay, so for example, here, the World Health Organization. This paragraph is just about the World Health Organization. It's telling you the services provided include all the way through. But this paragraph's different. It's identifying 1, 2, 3, 4 agencies, and it's giving you a definition of which each one of them does. Guys catching on?
Yeah.
Case manager, what's case manager? What does a case manager do?
Promoting
Coordinating
self.
care.
What?
Coordinate care. Coordinate care.
Yeah. All right, they're the care coordinator. Okay, so I want you to read through this section on your own, but the case manager responsible for coordinating care. We as nurses functioning as case managers all the time. We may not be called a case manager, but think about your patient load at the hospital. You're coordinating when, food service is coming in, housekeeping is coming in, the respiratory therapist is coming in, you're communicating with the doctor, with whomever. You're case managing. You're responsible for your patient. You're making sure everything falls into place, right?
Mhm.
Okay, you might be getting with the PTs, the dietitians, discharge planner, financial, whatever. Okay, violence and human abuse. What I really want you to know about violence and human abuse is primary prevention. Okay, primary prevention begins with a community approach that incorporates several different entities from the community. Okay, it involves criminal justice, education, social service, community advocacy, and public health. So maybe your question is, who's involved? Who's involved in the primary prevention of violence and human abuse in the community? What groups do we pull together? Criminal justice, education, social service, community advocacy, and public health, right?
Mhm.
And then here's some examples. I want you to know these. Okay, some examples some communities have used for primary prevention. Okay, and some great examples. Teach youth how to cope with anger, stress, and frustration. Family programs that teach how to deal with their kids more effectively. Preschool programs that work on developing intellectual and social skills. Okay, so I know we talk about violence and human abuse in another chapter with regards to violence, but this section here is talking about prevention, and we're trying to do it from the primary perspective. Okay, infectious disease. What do we want you to know about this? Well, number one, we want you to know that vaccine is one of the most effective methods of preventing and controlling communicable diseases, right? We know that. That's a fact.
Mm-hmm.
Some diseases, sorry, I'm still trying to get over COVID, so I've got this ridiculous irritating cough. Diseases such as, these are all your kid diseases: polio, diphtheria, pertussis, measles, right? They used to be in epidemics decades ago, but now they're controlled by routine childhood immunizations, right? They have not been eradicated, so that's why kids need to be immunized
Vaccinated.
against these, right? Yes, the United States has no shots or no school, okay? But there are exemptions, right? Parents can fill out personal exemptions, religious exemptions, they can get medical exemptions, and who are we to question that? We just need to be mindful, like I worked in the schools for 20 years, mindful of the kids who are not vaccinated. And if there's outbreaks of anything in the school that's communicable, those are the first kids, the parents we call and say, listen, we got this going on. Kid's not immunized. You might want to keep them home till this outbreak passes. Okay? Because we know that kids, infants and toddlers are the most susceptible to these severe diseases, okay? And then it gives here, surveys show here's your high risk groups that are not immunized and why. So that is right here. So maybe you get asked which groups might be at risk for not being vaccinated. There's 4 examples: inner city kids from minority and ethnic groups are particularly at risk for incomplete immunization. Okay, kids from religious communities whose beliefs prohibit them from getting immunizations. That's another group. Parents who have philosophical objections. Right, we know that adolescents have lower rates of coverage, right? Because they're the ones who frequently don't access their annual appointments. Right, the older you get, the more they blow it off. Surveillance outbreaks. Know the difference between observation and surveillance. Okay, well, let me take that back. Observation and surveillance are the process of ongoing collection, analysis, interpretation, dissemination. Okay, so does that sound like your nursing process in the community setting? Okay, so if you're surveilling an outbreak, right, you have to assess, you have to analyze, you have to plan what you're going to do, you have to implement what you're going to do, and then you have to communicate the results. Right? Why do we observe outbreaks? Right? Because we need to see what disease patterns are. We need to see what resources we need, what kind of rapid response we need. Right? And what is the purpose of surveillance? It's to reduce morbidity and mortality. Right? By preventing or controlling the spread of the disease. Okay, that's what it is. What is it not? It does not focus on eliminating community-based infections, right? We're identifying and surveilling. Okay, here, this is again a bunch of definitions. Surveillance systems are essential in protecting public health with early detection and implementing interventions to reduce the goal up here, which is morbidity and mortality. Okay, so you need to know what a passive system and what an active surveillance system is. Okay, right here, passive and active. Okay, I can tell you as a school nurse, I did passive surveillance when the health department relied on me or doctor's offices or hospitals to provide existing data. So a hospital calls, hey, we got 10 people in they're all vomiting from a restaurant they ate at, and it's the same restaurant, right? So they rely on people to call in with information. You know, a parent calls in, I was at the doctor's office, my kid has pertussis. And then the active system is then the health department starts searching for other cases. Right? So if they get a call from a hospital about 10 patients showing up with GI stuff and they all ate the same restaurant, Health department may put out an alert to the other 4 hospitals. Hey, if you get anybody that comes in with this and this and this, notify us.
So the passive is pretty much what they're being told. They're calling, they're being told. And then
Yeah.
active is they already have the information. Now they're going to do research.
Now they have to surveil it, figure out how big is it,
Right. Okay.
right?
Mhm.
Know your patterns of occurrence when looking at outbreaks. Okay, don't get overwhelmed at this. There's several patterns. One is a point source outbreak, gives you the definition right here. One's an intermittent outbreak, gives you the definition and example right here. Then we have a mixed outbreak right here. Okay, and then we have a propagated. Okay, and it gives you an example. For example, a mixed outbreak. When a person is exposed to a source and it's person-to-person contact, like the flu. Okay, so you got to know those 3. I thought there was one more. There is one more, but it's not in here. So just focus on, oh no, there's 4. Point source, intermittent, and it gives you an example, it gives you a definition and an example. Okay, and then this talks about community-based programs. How do you do it? You use your ADPI, you conduct a needs assessment. That's first, right?
Mhm.
That's your A, right? And when you conduct a needs assessment, there's a few stages. Okay, here's your pre-active stage. Tells you what you do. You're going to be projecting future needs. And you have a reactive stage, right? So this is the first thing you do is your needs assessment. What kind of information are you going to collect during these different stages? Pre-active, reactive, inactive, and interactive. So again, another definition paragraph. So maybe giving you a scenario to say, hey, the nurse is doing a needs assessment. She's trying to determine the problem based on what's happened in the past. Is this the reactive stage, pre-active, interactive, inactive? Okay. Make sense?
Yeah.
Patch model. There's 3 different models for surveillance. The patch model tells you exactly what it is. Focuses on mobilizing the community to act, collecting data, choosing health priorities, and then developing an assessment plan. That's the patch. Then they have, the second one is the assessment protocol for excellent public health model. That focuses on assessing and setting priorities for health problems. Then there's a third one. It's called the MAP, M-A-P-P, mobilizing for action through planning and partnership. And that develops a framework for long-range planning. So, question. In developing a surveillance model, we would like to get the community involved, helping us collect data, helping us with an intervention plan. Which type of model would we be using? The patch model, the assessment protocol for excellence in public health model, or the MAP model?
The MAP model.
No, the patch. Because I just said we're gonna use the community. We're gonna use the community to help us. We want them to help us collect data, and
Okay, yeah, that's
you
it.
just
I'm
need to know
sorry.
the definitions. Okay.
Mhm.
All right. Managing quality and safety. Okay, what we need to know with this is what's the difference between continuous quality improvement and quality assurance. Remember that from class?
Mhm.
This should all be just a review, right?
Right.
And this should be a review. That's what this is, a review. So there's your 2 definitions. And then this is about when developing a quality improvement program. What do you need to do? Okay. And this is the tracer method, is a measure of the process and outcomes. Okay. So you guys remember the tracer method? What do they have to have? if you're participating in a program or a, a study that's using the tracer method, remember this, the clients have
Yeah.
to have the same disease, the same stage of illness,
Mhm.
same lifestyle, same interventions, live in the same community. Remember that?
Right.
Mhm.
Okay. And this is a nice little summary of tertiary, primary, secondary, tertiary. Kind of goes backwards, but tertiary focuses on the outcome, right, of a quality improvement because we've already identified there's an issue. Then we'll put together an action plan. And now tertiary, we're seeing how things are going, right? Developing an education on vaccinations is primary. Providing low-cost vaccination clinics at the local elementary school and reviewing flu data is secondary. We're trying to see who's at risk, right?
Screening, yes.
Yeah. Okay, now we're doing QI programs that has phases. What's the first phase? Structure phase. Goes through what it is. You will determine if the philosophy and objectives align with the job descriptions in your organization. Next is the process phase, where you're going to evaluate the quality of care by reviewing nursing care procedures. And then lastly, you have the outcome phase. What are you going to do in the outcome phase? Evaluate the results of the QI program by monitoring client safety. Okay?
Mhm.
Ethics. I need you to know your ethical principles. Okay, it tells you right here, the ethical principle of respect. That's one, focuses on obtaining informed consent. Right? You're respecting each individual and their ability to participate. Beneficence, the ethical principle of beneficence. What's that?
Minimizing risk.
Correct. Do good. Right? Justice. What's the ethical principle of justice?
Equity,
Equity.
making sure we treat everybody equally.
Couple of theories that you need to know. And again, there's tons of definitions in the study guide. What's utilitarianism? What's deontology? These are your ethical theories here. These are a few of your ethical principles. Okay, so your theories, here's another one. Utilitarianism tells you what it is right there. Deontology tells you what it is right there. Distributive justice, right, is another one. And then consequential. Consequentialism, based on the consequence of the action. So again, I'm just trying to break these down for you. So it doesn't seem like it's so wordy and so confusing. If you start to pull out the key words, it becomes more organized, is it not?
Yeah.
Yes.
Yeah. And then know what feminist ethics are. What are feminist ethics? What are feminist ethics advocates? What are they advocating for? Economic, social,
Economic,
political.
social,
Yeah.
mhm.
Yeah. And what do they reject? Abstract rules and principles. Okay. What's virtue ethics? Right? Virtue ethics is we try and enable people to flourish as human beings. Okay. What's non-malfeasance? Do no harm. That also goes up here, ethical principle, non-malfeasance. Beneficence is do good, non-malfeasance, do no harm. And then what's caring ethics? It's all about relationships,
Moral values.
right? Values and relationships. Yep, yep. Moral values, yeah. Okay, let's see. Cultural influences of nursing. Okay, so here you have to know, you need to know the difference between the first paragraph is immigrants, the second paragraph is refugees. Those are the two big populations you need to know. Okay, a lot of their issues are the same, but there are a few things that separate them. Well, and the one big one is with the refugees. I mean, when working with immigrants, yes, they need healthcare and housing and all that. But if you think of the refugees and where they've come from, you can read right here. These these people have often experienced traumas such as torture. The priority, let's say the question asks, what's the priority for the nurse when working with a refugee? Gives it right here. The priority is access to therapy. Yes, they're going to need to know about transportation. Yes, they're going to need to know about social norms. Yes, they're going to know about communication and healthcare and whatever. But what's the priority of a refugee? They first need access to therapy. That's a big difference. Okay, you can read through these last two. It goes through a couple of important points about Native Americans and some of their beliefs and values, and then Hispanic. Okay. And then here's great. Here's a summary of what you need to know for your math. Here's how to set up a drip calc. Here's how to set up an infusion time. Okay. How's that? Short and sweet.
Yeah.
Don't want to
Yep.
overwhelm you. I used to do these for 2 hours, and by this end of the second hour, students were just like looking at me like, please stop talking.
Sorry.
So I try and succinctly do it in an hour and just go through it. I mean, again, none of this should be unfamiliar to you. Yes, you may need to re-educate and read up on it, but none of these topics should be unfamiliar to you if you've been in class. Feedback, helpful?
Yes.
Yes.
Yes, definitely helpful.
Yes.
Good,
Thank
good,
you.
good.
Thank
All
you.
right.
I like is that you gave us examples of how we can
Yeah.
put into a question.
Yeah,
Mhm.
every
Different
time you
ways
read,
to-
every time you read one
That's
of
what I
those
try to
little
do it.
paragraphs, think about what are they going to ask me? There sure is a lot of definitions in this paragraph. Maybe they're going to give me a scenario and ask me to identify which one it is. Always try to ask, well, why do I need to know this? What are they going to ask me?
Yeah.
Okay.
Yeah, thank you,
Yes.
Professor.
You're
Thank
welcome.
you.
I got to get going. I got to teach a class in a few minutes, but
Thank you.
Thank you.
yeah,
Thank you
you're
so
welcome.
much. Please feel
And
better.
Thank you. Thank you.
you're welcome. Did everybody put their name in the chat?
Yes.
Yes.
Okay.
Yep, we
All right.
did. Thank you.
Yep. See you guys. Bye.
Thank you.
Bye.
Take care.
You're welcome. Bye.